Hello, my name is Elizabeth Hall, and this presentation focuses on the relationship between inclusion and student achievement for students with disabilities. First, let's look at some baseline data. We're going to look at LRE versus grades. First, what is LRE? LRE stands for Least Restrictive Environment. Under the Individuals with Disabilities Education Act, it mandates that students with disabilities be educated alongside non-disabled peers to the maximum extent. So we see as the level of inclusion decreases, student achievement in both math and reading significantly declines. You see that those that have an LRE of 1, they're in the gen ed classroom 80 to 100% of the time. They have a 90 in math and a 90 in reading. And then you see if the students that have an LRE of 3, which means they're in the gen ed class 40 to 79% of the time. Their math score is a 79 and their reading is a 75. And these are averages, of course. And then those students who have LRE of 4, which means they spend less than 40% of the day in the gen ed classroom, their math score averages around a 60 and their reading score averages around a 59. So you see as the level of inclusion decreases, their grades significantly decline. This suggests a need to address barriers preventing effective inclusion in general education classrooms. Research shows that inclusive practices improve academic outcomes when implemented effectively. However, teachers often say that they feel unprepared or reluctant to include students with disabilities. They say that it's due to lack of training, or their confidence is low, or they don't feel prepared, to help these students with disabilities. However, increasing teacher confidence through UDL could help close that gap. It could help close the achievement gap in the data. UDL is Universal Design for Learning. It supports diverse learners. UDL often increases teacher confidence, student engagement, and achievement. So let's look at the action plan, the sampling method and sample. So this will include 15 general education teachers, 45 students with disabilities, and the grades will range from pre-K through 6th grade. And then the sampling method will be purpose sampling. I chose purposes sampling because I'm able to choose participants based on a specific characteristic that's relevant to this study, thus being the 45 students with disabilities, varying from pre-K to 6th grade. So now let's talk about the instrumentation. We will conduct a teacher survey. We will do this before the professional development and then after. The survey will gauge how teachers feel about inclusion. And then once we have introduced the teachers to the UDL practices, the Universal Design for Learning practices, and we teach them through the professional development, we will begin conducting classroom observations. We will use a checklist, which will be used to grade teachers on their UDL implementation. And then over the 6 to 8 weeks, we will collect students' grades, their math and reading scores, to see how the implementation is affecting the students' scores. This study is going to have a lot of people involved. The collaborative efforts are going to be between general education teachers, special education teachers, instructional coaches, and then also school administration. So the procedures is going to be collecting baseline data. We're going to take the grades, the math scores, and the reading scores of the students. And then we'll also be the pre-surveys will be our baseline data. And then we will provide the Universal Design for Learning professional development to the general education teachers. And then over 6 to 8 weeks, we will ask the teachers to implement the strategies that they were taught during the professional development. And through that time, we will also conduct observations and then collect reflections from the teachers as well, and also collect those reading and math scores of the students also. And then we will collect post data, which will be the post surveys from the teachers. And then we will gather all of the math scores and the reading scores and compare where the students were from the beginning of the 6 to 8 weeks and then where they are now at the end of the 6 to 8 weeks. So now let's talk about validity, the internal and external validity. So the internal is going to be based on consistent training and observation tools. And then also the same assessments, we're going to use the same teacher survey for before and after. And then the external is the limited generalizability due to small sample. So we're only using a small group of students and a small group of teachers, and replication needed in other settings. So we need to continue what we're doing across all school settings. So with this study, there are several ethical considerations that need to be addressed. The first thing is everything must be kept confidential. No student names can be used. All data reports must also be kept confidential. And because of the special population that we are using to conduct this study with, which are students with disabilities, they are protected under federal law. So all of their information is to be kept confidential. And then we need to ensure equitable access and support for all of the teachers involved as well, that they are able to access any of us and have the support from us to implement the UDL strategies that they were taught in the classroom. Other considerations that need to be taken into account is that approval will be required before conducting studies. Under the federal law that protects all of the students, we will need to get approval from their parents that we can use their information, that we can use their information in their IEPs, although their names will not be published, but we're accessing their records. So we will need parent approval for that. We will ensure that all ethical treatment for all involved. All participation is voluntary. So if any teachers do not want to participate, if any students and parents do not give them permission or give us permission, then that's okay. We will get consent from the teachers to participate, and then most importantly, we will ensure that we do not interrupt instructional time in the classrooms. So if the action plan is effective, we expect to see increased teacher confidence in inclusion practices, increased use of inclusive practices in the classroom, improved student engagement, and higher math and reading scores for those students with disabilities. So our ultimate goal is to reduce the achievement gap between LRE levels by increasing inclusion. So the changes that we want to see are that the LRE3 scores increase, LRE4 scores show measurable growth, and that overall we see an upward trend in all subject areas. After looking at the action plan, some changes that might need to be made to the original plan is we possibly need to extend the timeline beyond 12 weeks. Giving a 6 to 8 week window may not be enough time to see growth within these students. Some may grow faster than others, or some may be slower, and so we may need to give them a little bit more time. We may also need to provide ongoing coaching instead of a one-time professional development session. These teachers may need to meet every 2 weeks or every month, or just provide more support in teaching them on the inclusive practices, and include more frequent observations. So visit the classroom more often, provide support, provide more time of observations for them. Some additional research that could be done is looking at the long-term impact of UDL implementation. What does that look like if we continue to implement UDL over beyond the 6 to 8, even 12 weeks? What does that look like? What is the impact on the different disability categories? There's not just one broad disability. There's several disabilities that would be involved within these 45 students. So what's the impact on each individual student? And then the teacher's mindset. We said that research often shows that teachers do not feel confident. They do not feel prepared to help these students. So what would their mindset look like over time? Would they be more willing to practice these inclusion strategies, or are they still resisting? What does that look like over time for them? I thank you for your time and your attention to this study. This is something that is near and dear to my heart as a special education teacher. I feel like inclusion is so important, and I have seen with most students, the more time they're able to spend in the gen ed classroom, the better they perform. And not all students are able to be in the gen ed classroom the majority of the time. That's just not what's best for them. But that's why it's so important to set the LRE for each individual student to their max, what they're able to do, because I feel like being in the gen ed classroom is truly what is best for most students. And so I feel like this is something that needs to be addressed within the school system. It's an issue that I have seen and observed personally as a special education teacher, and I feel like inclusion needs to be implemented in classrooms, and that gen ed teachers need support and they need strategies to be able to implement inclusion within the classroom. Again, thank you for your time and attention.